My name is Julie Herlihy. I'm a pediatrician by training, and I work at Boston Medical Center and Boston University, Center for Global Health and Development. And here at the center, we do research, applied research, to find out if different interventions work at the community level in order to prevent child mortality, and in the case of this study, newborn mortality. And our study is called ZamCAT, which stands for the Zambia Chlorhexidine Application Trial. The background of why anyone does any of these studies is that every year, about 10 million children under the age of 5 die from something that's a preventable cause. What's interesting about that is that of that 10 million, 4 million, so 40%, are dying within the first 28 days of life. And when you look at some of the reasons of why babies die in that first month, about a third are dying from infection. And there was a group that was doing a project in Nepal that looked at trying to use an antiseptic wash called chlorhexidine on the umbilical cord of these newborn babies as a way of trying to prevent infection. So they found that they were able to reduce what we call neonatal mortality, or newborn death, by 25 to 30% by using this antiseptic wash. And the brilliant piece of it is that the wash is cheap, and it's been around for a long time. It's something that we use in hospitals across America, what we use to clean our hands before we go into surgery, to sterilize equipment, etc. And it's quite safe. So this almost seems like a win-win opportunity. What hadn't happened is no one had tested it yet in sub-Saharan Africa. So that's when our group was invited to join, and where our project has come from. We heard about a lot of different traditional beliefs associated with the umbilical cord. So one of the beliefs is that it's better for the cord to fall off faster rather than longer. But because of this belief, people will put drying agents on the cord to accelerate the process of the cord actually dropping off. They include things that could be as benign as breast milk. They sometimes will put alcohol on it as an antiseptic. They put things like baby powder. And they'll do things that are maybe not as benign, such as putting charcoal from the fire, ash. We heard about using cow dung, chicken dung. We heard about elephant dung, or even marijuana being used. There's a lot of opportunity to try and reduce risk of infection by doing some simple interventions, and chlorhexidine, we're hoping, is one of them. Well, I think that this project is setting out to answer a really important question, which is, can a simple solution like using this antiseptic chlorhexidine actually provide the impact that we're hoping that it could? Or is what we really need to do just education around dry cord care? That's the question at hand.